Okay, John, and now I'm going to sign here that you may, as a witness, and put the date and time. All right, and then let me just look. Oh, and this questionnaire you will have to fill out.
Yeah,
And if do you drive any longer?
I have, yes.
Okay, so that section needs to be completed as well. So
Right.
have a seat with this part of the questionnaire, and just bring that back up when you're finished. Thank you, John.
Thank you.
Hi, Richard.
Hi, Dr. Evans. How are you?
Good. We've got 2 tests that we're going to do before we do the procedure for your macular degeneration. All right?
Great.
This is called an aberrometer, and what it does is it puts an image on the surface of your eye, and it does a surface map, like a topography. Because that's all we're going to be doing is changing the shape of the cornea, the very outside of the eye. This laser that we use is a very mild laser. It does not even penetrate through the cornea. It's considered eye safe. It's actually safer than some of those little pen light lasers that you can buy at Walgreens.
Yeah. Okay.
Okay?
Yeah.
It's considered eye safe because it doesn't really go into the eye. It just stays on the surface. And we're going to change the shape of the cornea so that the image, when you look at something, the image, instead of going right to the bad part of your retina, it's going to be shifted off a little bit to the side to a good part of the retina that's still working. Okay? This machine there's probably only about 10 or 12 of these in the whole United States. It's called a microperimeter. And what it does, since you can't, if you look right at something, you can't really follow it. It will take a picture of the back of your eye, and then it knows your blood vessel pattern. It can track your eye movement, so it keeps you centered. Even if your eye is moving around, it keeps you centered. And then it's going to test the different areas in the back of your eye to see which ones are working and which ones aren't working. Okay? And that tells us where to move the image.
Is this anything like LASIK?
No, in LASIK, where you'd lift a flap of the cornea and you'd actually remove tissue.
Oh.
We're not removing any tissue, and the recovery, you don't have to take any drops or antibiotics afterwards, and the recovery is instantaneous with the procedure we're going to do. Right?
Mm-hmm.
Okay. Okay, Larry, this is the result of that one test that we call a microperimeter that you were looking in and it was giving you the different lights.
Push your button.
Yeah, and our goal is to shift the image so that it hits right there where you've got good vision. All right? And the sensitivity will improve over the next year or even 2 years, according to our other patients that we've done. And your vision should get better and better and better over time. Larry, just give it your best effort. I know it's hard to see because you've got the macular degeneration.
Yes, sir.
But as low as you can get, we're trying to find out before the surgery the best you can see out of each eye and together with both eyes. And then afterwards, we'll be testing you about every 3 months just to see how it works.
Fine.
Good.
Fine.
This helps couple the laser to your eye. It has magnets inside of it. And the laser will connect to that. You look straight ahead. Good. Look down just an inch. Look down just a little bit. That's perfect. Suction. Suction. Let's get on. Good. Couple together. Go ahead. Okay. That one's done. Let's do the other one. Good. You have perfect colored eyes for me because I can see the X.
Oh, yeah.
Go ahead.
That's good.
Okay. And a couple.
All good.
Okay, the treatment's over. Wasn't that easy?
Well,
In a blink of an eye. Actually, it's only 0.17 seconds, so it's faster than the blink of an eye.
I know, good luck.
Now this suction ring has little magnets inside of it so that the laser can be connected to it. You won't feel much. And you can start the suction.
That's good.
Good. Okay, treatment.
Well done.
All done.
And that's the only eye to be treated. So.
Yes, that's it. Didn't feel anything, did you? Good. This ring has little magnets inside of it so we can connect the laser fiber optic. Look straight ahead. And suction on.
Not. What?
Suction on.
That's good.
Thank you. And the fiber optics will carry the laser to the instrument. Go ahead.
Okay.
All
Released.
done. Released. And that's all there is to it. Now we'll do the other eye. Suction ring. Keep it nice and moist. And I can see perfectly where the centration is. Suction on.
That's good.
And they're connected magnetically. Good.
Okay. All finished.
All done. Treatment's over.
Hey.
Pretty simple, huh?
Yes, sir. And you didn't feel a thing, right?
Did you feel it?
Nope.
Not much. Good.
That's the way it should be.